how's the sound on your end?
Sounds great.
Terrific. So welcome. I'd like to thank you for the opportunity to talk with you a little bit about the Natural Medicines Comprehensive Database today. And I'd like to congratulate ACHS for having selected the 2 gold standard databases for your students to use, the Natural Medicines Comprehensive Database and the Natural Standard Database. Just to acknowledge that the information that I'm providing comes from the Natural Medicines Comprehensive Database. It includes copyrighted information, and I've been given permission to share this information and discuss it. So I'd like to go through some objectives briefly. At the conclusion of this presentation, those who are viewing or who will be listening to the presentation should be able to successfully log on to the Natural Medicines Comprehensive Database to orient to the layout of the database and its available features, to discuss the editorial perspective from which Natural Medicines Database content is presented, to identify and apply various Natural Medicines Comprehensive Database ratings definitions, to identify and utilize various Natural Medicines Comprehensive Database search features, and to locate and select specific natural medicines in the clinical management of various health conditions, continuing education programs for additional study. So I understand that the way in which ACHS students log on to Natural Medicines Database is through the ACHS website, that you go to the online classroom, click on the library module, go to library databases, and then select the Natural Medicines Comprehensive Database. And I believe this slide shows you where on the menu to select the library databases from which you will then be able to click on and log into the Natural Medicines Comprehensive Database. Now, once you've logged on, you'll come to the home page. And if you haven't yet done this, it's valuable to go to the About the Database section. And I'll come back to this in just a moment, but I want to point it out. You can see it here circled in red, About the Database. And when you click on that link, you'll be taken to a very, very long page that has information about every section of the Natural Medicines Database, as well as some brief video tutorials about each section. Now, the other thing I wanted to point out on the home page is that there are a large variety of angles from which, or perspectives from which, you can search the Natural Medicines Database. They include the general search feature at the upper left, and then a search feature here right below the home word on the menu on the left. When you click on search, it then produces a secondary menu that allows you to search via product or medicine, effectiveness, interactions, nutrient depletion, or something called advanced search. In addition to that, here on the home page, you can go directly to various search features and search them individually. And we'll come back to all of this when I go live onto the website and we explore it a little bit together. Lastly, I'd like to point out that in the lower section of the home page is a list of the Clinical Management Series continuing education programs. And these are programs which view the Natural Medicines Comprehensive Database information from a disease-specific condition rather than from an individual substance perspective. So when you're searching in the Natural Medicines Database and you look up a topic like coenzyme Q10 or St. John's wort, you'll come to a monograph that will have a large variety of information organized in a very specific manner about that topic. But when you go to the Clinical Management Series programs, they'll discuss specific health conditions and both a general overview of the conventional treatments as well as what is known from an evidence-based perspective about the alternative or complementary medicine treatments, including any of the topics that are listed in Natural Medicines Database. So I'm going to switch screens now and go live to the Natural Medicines Comprehensive Database. And we're on the home page, and we're going to look at About the Database. And here again is the beginning of this very, very long page. You can click and go directly via hyperlink to information about different sections of the database and different pieces of information about the database, as well as watch specific tutorials. There are a variety of tutorials available.
Natural Medicine's comprehensive database lets you conduct different types of searches to find answers easily and quickly. The search box in the upper left-hand corner.
So I don't want to keep going with the narrative with that, but along the right column you could see a variety of topic areas with brief videos that give you a quick orientation to each of those topic areas. As you read down through this introduction to the Natural Medicines database, it introduces a variety of the unique tools that are available, and then it begins to talk about and describe the monographs in each section. Each monograph contains an also known as section. These are common names by which the same substance is referred. The scientific name or scientific names, this is especially important with herbals, with botanicals, that one can identify the current accurate binomial nomenclature, the scientific name. There's a section on what people use this for. These are common promoted uses for which the product is discussed or recommended out in the general world. It has nothing to do with actual efficacy or evidence of efficacy. There's a rather extensive section on safety, discussing safety in adults and in special populations, including children, pregnant and lactating women. There's a series of ratings for the safety system, from likely safe to possibly safe, possibly unsafe, and likely safe and unsafe. And the important thing about this, about the Natural Medicines database page, is to be able to read the definitions for these ratings and understand what they mean. The next section is the effectiveness ratings. Again, there's a variety of ratings based on the evidence, and you can read about how the evidence is applied to reach an effectiveness rating for the individual monograph topics in the database, everything from effective all the way to ineffective. There's a section in each monograph about mechanism of action. That's the pharmacologic action or actions of the constituents of plants or of the individual substance, if it's an individual substance monograph. There's a section on adverse reactions or side effects. There's a section on interactions, and it's broken into interactions involving herbs and other dietary supplements, a separate section on interactions with drugs, a section on interactions with foods, a section on interactions with lab tests, and finally a section on interactions with diseases and conditions, which we would also refer to as contraindications and cautions. This would be conditions that a person might have for which they should avoid or be cautious in using a particular natural product. Again, the interactions section has a rating system. We discussed that a little bit in the last webinar, but basically using a variety of factors, each interaction between the substance about which the monograph is written and the area of interaction, whether it's herbs and other supplements, whether it's drugs or foods, lab tests, or disease conditions, are rated as red or major. This is interactions that can have a serious outcome if they occur. Moderate, these are interactions which could have a significant outcome if they'd occurred, and minor, these would have a minor or a low likelihood of problem if they occurred in a patient. And it is really valuable to read through and understand how these ratings are put together and what the classification or the rating means when you see it in a specific monograph. Following the interaction section, there's a section in each monograph about drug influences on nutrient levels and depletion, a section on dosage and administration, and finally there's a section on editors' comments. And this is kind of a catch-all area that the Natural Medicines Database editors use, where information that they feel is relevant to the reader but doesn't fit well into one of the other sections can be listed for additional information that you might find useful. Now, in addition to all of this information, the Natural Medicines Database is fully referenced, and at any point when you're interested in seeing more information about a statement, simply click on the number or numbers at the end of the statement, and it will open a separate window providing the citation. That citation, if it is linkable to a PubMed abstract, will be hyperlinked, and if you click on it, you will go directly to the PubMed abstract. There's a section called Tell the Editors where you can provide feedback. The Natural Medicines Database is updated on a daily basis by their team of editors and researchers, most of whom are drug information pharmacists with doctor of pharmacy degrees. Now, another unique part of the Natural Medicines Database is the brand name products. There are nearly 90,000 brand name products listed in the Natural Medicines Database. When you click on a specific brand name product, you'll see a window that will identify all of the ingredients as they are identified on the manufacturer's label. There is a collaboration between the U.S. Pharmacopoeia Dietary Supplement Quality Program and the Natural Medicines Database. So products that are verified by the USP verification program are listed in the Natural Medicines Database and identified with the USP verification logo, indicating a product of guaranteed quality. There is information in the Natural Medicines Database about Canadian licensed natural health products. I don't know at this point if it affects many of the students in your program, but if you are interested in Canadian licensed products, there is information included in the Natural Medicines Database about them. And then lastly, I wanted to mention the Clinical Management Series and the Special Reports. These are two different types of continuing education programs that are available for licensed health professionals, but they're also available to anyone who subscribes to the database. And again, these allow you to look more specifically from a different angle at information about natural medicines and to get a fuller and richer perspective on the evidence base and how it can be applied in clinical practice. So I'm going to go back now to the home page. And again, I wanted to mention, here is the search window at the top upper left. You can also move your cursor over the search feature in the menu on the left-hand column and go directly to a search feature for product or medicine, for effectiveness rating, effectiveness in specific conditions, for interactions, drug depletion, nutrient depletion, or the advanced search feature. So let's take a look for a minute at the advanced search feature. And what this provides you is a menu for searching under any specific type of category that is available in the Natural Medicines Database, either by typing into a search window or by viewing a category, a listing by alphabetical listing of a variety of different types of categories of information that is included in the database. There is also a unique feature that allows you to search for keywords in any or all or any variety of the monograph subheadings that are available in the database. So right now, if I wanted to search for the word digoxin, the drug digoxin, I could type it into the search window, and because all of the different categories are checked, my search will provide me with a listing of every section of every monograph in which the word digoxin appears. Alternatively, I could unselect all the fields and simply look under interactions with drugs and search for digoxin. And now I'll come up with a list of specifically those monographs where interactions with drugs includes the term digoxin in bold, but notice it also tells me about other sections of monographs in unbolded print that include the term digoxin. So this is a really powerful search feature that can help you identify or find information on a word-by-word basis, and you can search any word or any chain of words that you wish. So let's go to a monograph quickly. We'll go to the ginkgo monograph. And when I search the term ginkgo, it gives me a variety of hits within the database, all of which include the term ginkgo. I can go to the Natural Medicines in the Clinical Management of Alzheimer's Disease, which is one of the continuing education programs, and this will give me an overview of the use of natural medicines in Alzheimer's disease, beginning with conventional treatments and then going on to discuss natural medicines that have been proposed or found to have some benefit in the treatment of Alzheimer's disease. And I really want to encourage you to explore these clinical management of various disease reports. They can give you a really interesting and different perspective on the information than if you were to look at a specific monograph. So for instance, we go to the ginkgo monograph, and again, it's broken down into the organization that I discussed earlier in the About section. You can see there's an also known as, scientific names. People use this for all the way down to the comments section. And you can jump from one section to another here at the top of the monograph. Notice that the Natural Medicines database allows you to now see the 2,390 products containing ginkgo that are listed in the Natural Medicines database. This is another option that comes up when you search the term and go to the monograph page. So it will bring you to a listing of products, all 2,290. You can also jump directly to see the 4 USP verified products which contain ginkgo. And here it gives us this 4, and then the beginning of the listing of the 2,290 or whatever number it was of products which contain ginkgo. Now, not only does it give you a listing of these products, but it rates the products according to the NMBER system, the Natural Medicines Brand Evidence-Based Rating System. And this system takes into account a variety of types of information, from the number of ingredients in the product to the ingredient safety ratings, the ingredients efficacy ratings, and information that is available about product quality. And using a proprietary algorithm, the Natural Medicines database generates an NMBER rating number. So if we go to 12 Baskets Ginkgo biloba by Enoch Nutrition Research Development, we see that this is a product that contains ginkgo biloba in a 50-to-1 extract. It describes the rest of the content, and it contains 60 milligrams of the extract, as well as the inactive ingredients. And it rates this product as an 8. Now, according to this rating system, any product that rates in the green zone is a product that a licensed health professional would be encouraged or feel confident to recommend to patients. Any product that is rated in the yellow zone, from a 4, 5, 6, or 7 rating, is a product for which there is inadequate evidence of safety, efficacy, and product quality to be confident about the product, and therefore a licensed health professional should be more cautious about recommending or avoid recommending the product. Those products that are rated with a red rating, the 1s, the 2s, and the 3s, these are products for which there is some potentially significant problem involved with the product, and that licensed health professionals are encouraged to have to recommend avoiding these products specifically. But the rating does not indicate the grounds on which the specifics of the rating apply. So you don't know, for instance, if a product is rated red, is it because it contains 1 or more unsafe ingredients? Does it contain large numbers of ingredients in quantities that are too small to have therapeutic efficacy based on the evidence of efficacy available for each of the ingredients? Some kind of a known or reported quality problem with the product, or something else. So you do have to take this information with a little bit of grain of salt. And again, it is designed primarily for licensed health professionals who are involved with the care of patients that are using both prescription drugs and dietary supplements or natural products. Let's go back now to the home page. And at this point, let me open my window if I can find it, and see if there are any questions before I move on to the next section. Are there any questions? If you have questions at this point, would you type them into your communication window? I'll give you a brief minute here, and then if I don't see any questions, I'll move on to discuss another section of the Natural Medicines database. So not seeing any questions, I'll return to the full page view. And let's go back to the home page. We've seen how the general search feature works by simply typing in the name of a product or the name of an ingredient to search for a product listing or for a monograph. The Natural Product Effectiveness Checker allows you to search by ingredient or by disease state, so that you, by disease condition. So if we wanted to find out what natural products are rated for effectiveness for the condition of hypertension, we would simply type hypertension into the search window, and now it will list a variety of kits by effectiveness rating. So under likely effective, the DASH diet is the only listed monograph for which a likely effective rating has been given based on the evidence of effectiveness. There are a variety of individual products that are listed as being possibly effective, everything from alpha-linolenic acid to cocoa to fish oil to green coffee, all the way down to wheat bran. There are also listings of those products which have been found to be possibly ineffective, which include EPA all the way down to vitamin E. And then there's a listing insufficient evidence. And these are topic areas or substances for which there is either too little information or conflicting information that does not allow us to say that one side or the other side of either effective or ineffective is more heavily weighted by the evidence. And so at this point, we aren't able to discern whether or not or to what degree we can associate any level of effectiveness with these interventions and or products. And as you can see, this is quite an extensive list for the condition of hypertension. And notice that at the very top of the list, again, there are two natural medicines in the clinical management of specific disease states listed, in which natural medicines and hypertension are discussed. One is the clinical management of hypertension, the other is the clinical management of heart failure. The natural product drug interaction checker is one of the most valuable features of the natural medicines database because it allows you to search for interactions between a variety of drugs and supplements. So let me put a couple of drug names in. Let's put in warfarin, which is an anticoagulant. We'll put in digoxin, which is a drug that's used to treat heart conditions. We'll put in ginkgo biloba, which is a very commonly used and promoted herbal. Let's put in St. John's wort. Again, a very commonly used and promoted supplement. And let's put in fish oil as another example. And then we'll select the check interactions feature. Oh, I'm sorry, let me point out one more thing. Notice that the drugs are highlighted in this sort of a greenish blue, and the supplements are highlighted in sort of a purplish blue, and that there is a little dustbin to the right of each one of these. You can simply click on the dustbin and it will remove this this line from your list. So we'll check the interactions, and notice that now it tells us that there is an interaction with St. John's wort and I'm not sure what the drug is here, so let's take a look. We can view it, and that it will tell us that there are a variety of interactions, including with warfarin, cytochrome P453A4, and cytochrome P452C9 substrates. So you can then read about the interaction and the level of evidence, and you can see the interaction rating as far as major, moderate, or minor. And then by hiding the details, you can continue on to look at other interactions that are identified by the interaction checker. Here's one with lanoxin is the brand name for digoxin, and St. John's wort, anticoagulant drugs, and fish oil. So it gives you an opportunity to take a list of drugs that a patient may be using, a list of supplements either they are using or that you might want to be considering, and then see what potential interactions might exist and what kind of cautions are necessary to avoid problems that could result from drug interactions. So go back to the home page. And let's look at the nutrient depletion checker. This is a very interesting topic. Let's say that a patient is taking the prescription drug Zocor, and Zocor is the brand name for a prescription drug, the generic name of which is simvastatin, and this is a drug that's used to lower cholesterol. It's a member of the statin drug family. So we'll check the nutrient depletion that's identified with it, and it says that there is a depletion rating, but it's insufficient to rate, and we can look and view it more specifically. It turns out that what this will reveal is that the drugs in this class, these statins, which are also referred to as HMG-CoA reductase inhibitors, reduce serum coenzyme Q10 levels. Now, this we know from human studies, but what we don't know is what the healthy range of coenzyme Q10 is, and whether the statin drugs reduce the CoQ10 blood levels to a level that puts the person into a nutrient depleted state, or if it simply drops the level of CoQ10 within the normal range but lower than it would have been without the statin drug. So there are a variety of ways in which this information can be used. Some practitioners would say, well, CoQ10 levels are dropping with the use of the statin, so let's give the person some supplemental CoQ10, and that way we'll be sure that their CoQ10 levels well, we don't have any evidence that there's potential problems.
Oh, Forrest, we're having a little bit of an issue with sound.
Is it better now?
There you go, that's better. So we were losing you the last few sentences.
Okay, so let me start back again. This nutrient depletion checker result shows us about the potential for statin drugs, which are also referred to as HMG-CoA reductase inhibitors, to reduce serum coenzyme Q10 levels or blood coenzyme Q10 levels. What's not known is whether this drop in CoQ10 levels reaches the significance of a true depletion, where the CoQ10 actually needs to be repleted for the person to be healthy, or whether the CoQ10 levels drop but stay safely within the normal healthy range and therefore are simply lower than they would have been, but the person still has a healthy amount of CoQ10 in their blood. And so this information can be used clinically in a variety of ways. One practitioner might decide, well, CoQ10 levels are dropping, so it would make sense to recommend that a patient use some supplemental CoQ10 to keep their levels as high as possible. Another practitioner might say, well, because we don't have any real evidence that the reduction in CoQ10 levels either reaches the significance of a true nutrient depletion or leads to any health problems with which we're aware, it would make sense simply to monitor the patient rather than have them buy a supplement for which we don't really have evidence that they're going to get any benefit. And both of these are valid perspectives. It really depends on the perspective of the clinician. There is also a section that you might be interested in, the Colleagues Interact section. And this is a section where you can actually post a question and get an answer, and there's a listing of the question and answers that have been previously posted that you can read. So here is one, for instance, about PPI, proton pump inhibitors, which are drugs that are used to reduce the amount of acid in the stomach, and the supplement magnesium. And if you click on this, there will be a conversation string about this topic area, and it was based on the message, we started checking magnesium levels on nursing home residents taking proton pump inhibitors, and nobody had low magnesium. Is the clinician missing something? And then there's a discussion going back and forth among various users of the Natural Medicines database about this question. And while I'm not going to go into any detail about this today, you can always post a question or post a reply to any of the conversations, or you can, again, begin your own conversation. And again, here under Colleagues Interact on the home page, you can read the messages or you can start your own discussion. There are also some charts available in the Natural Medicines database. There's one on nutrient depletions, and this is a really useful chart that is used by a lot of pharmacists. And it simply lists in alphabetical order the drugs, and then any nutrient that might be depleted, the known or suspected mechanism of action, and then any comments or clarifications that are important in considering the specific influence on nutrient levels and depletion. And as you can see, this is quite an extensive chart. It is constantly being updated, and it is another tool that you can use in practice or in your research. But again, remember that you can always do a search of the nutrient depletion checker a little further up on the home page. So at this point, let me ask again, what kinds of questions do you have? I'm seeing a question here about a similar database for Europe. This database, Natural Medicines database, can be accessed by, let me bring this back to this. Natural Medicines Comprehensive Database can be subscribed to and accessed by anyone in the world. At this point, I don't know what plans there are to include brand products from other countries. The only limitation really is that the information in Natural Medicines database is exclusively in English at this point. There is, and I will clarify with one exception that comment in just a moment. As far as, let me see what other questions are here. Let me close this window so I can see better. There is one additional feature I'm trying to find here. Let's go back to the ginkgo monograph. And you'll notice that there is a patient education handout here in the menu along the left-hand column near the bottom of this first area of features. And this is a really useful tool that you can use if you'd like to provide evidence-based information to a patient or to a customer. It takes the information from the Natural Medicines database and encapsulates it into consumer-friendly language, and these are much briefer, although this is an example of quite an extensive patient handout because there's so much information in the Natural Medicines professional level monograph about ginkgo. But notice how the information is broken down into bite-sized amounts, making it fairly easy and digestible for consumers to use. And again, this is one of the most comprehensive and extensive of the patient handouts, let me go back and give you one more example of one that is more simply based. Let's try coenzyme Q10. Let's go to the patient handout. And again, there's information about what it is, what's known about its effectiveness, and interactions and other pieces of important information, including dosing and how to use it. So this is a valuable tool for some people, depending on how much information your patients or customers may want about a specific topic that is found in the Natural Medicines database. Now, the patient education handouts are available in English, in Spanish, and in French. The full monographs are available, as far as I am aware, only in English. So if you do have somebody who's more comfortable with Spanish or French, you can print the patient education handout, and that will provide them with information if they're able to comfortably read in Spanish or French, the same information that is found in the English version of the patient education handout. I also just want to take a moment to point out the use of the references. So in the coenzyme Q10 monograph, there is a statement under the likely effective rating of effectiveness that coenzyme Q10 seems to improve symptoms of coenzyme Q10 deficiency. And if we click on reference 8160, now we can see what that reference is from Neurology in 1997, and we can click on the hyperlink and go to PubMed and read the abstract for this particular article from which that statement in Natural Medicines database was derived. Now, in a limited number of cases, the abstract and the reference listing may also indicate free access to the full text of the journal article. And it would be stated somewhere here near the bottom of the abstract, and it would also be stated over here on the right-hand side of the page. In this case, it is not available, at least as a free full-text article via PubMed, but you could potentially use the citation to pull the full article at a medical library or request it from one of the authors by searching down the authors at their designated or indicated institutions. Going back to the home page. At this point, what questions do you have?
Well, I'm just sending a quick message, but I wanted to add to what you were just saying about the full text articles and just make sure everybody knows that the college does also provide two interlibrary loan services, one through Learn, L-I-R-N, which is the, I believe it's Library Information Resources Network or Library Internet Resources Network, and OHSU, which is Oregon Health and Science University. So both of those are resources that are available to students, and they're places that you can order those types of journals and articles. So they can be on loan, and you can also purchase copies of the article. So you'll find those resources in specific classes. They're also in the library, and I definitely encourage you to take advantage of those also. They're not in every class, but they are in the classes where you would be doing extensive research, case studies, research papers, things like that.
That's a terrific opportunity and service. This is something similar to what our pharmacy students do through our pharmacy library and through the medical library on Oahu to request full text articles through services like Learn and through established medical libraries that have the resources to cover a vast variety of journals. Are there other questions related to the Natural Medicines database that I can answer right now?
Well, I have to agree. This has been so helpful, even for me. I mean, I've been using this database for years, you know, but just seeing how all of the different components work together has really just opened my eyes to how much more it can be used. So I'm looking forward to sharing this recording with students that weren't able to be here. I think this will be a great tool.
Terrific. Well, if anyone has questions after the webinar, feel welcome to email me here at the University of Hawaii, and I'm happy to answer any questions. There's a question that's just come in from Lydia. Do herbs have the same properties in the EU and USA? We have different soil and different climate, thank you. That's a really great question, and from the natural products perspective of Natural Medicine's comprehensive database, that question doesn't come in, although it's very true that the different environmental conditions, the different climate conditions year to year can play a major role in the quality of the herb constituents wherever the plants grow. What the Natural Medicines database is doing is looking at the scientific evidence of efficacy and safety to rate these.
Oh, Forrest, we lost you for just a moment.
Okay. I don't know what's going on. Is this better?
It is better, and you were just talking about the ratings of efficacy in the database.
The Natural Medicines database evaluates the published scientific literature to provide concise and evaluated information about the safety and the efficacy of natural products. It does not go into the details of how those products were derived. And many of the products that have been researched are products that have been manufactured rather than using wild-crafted herbs in their natural state or in an alcohol extract in the way that an herbalist might use them in clinical practice. So it's a great question, and it's one that really hasn't been addressed in any of the evidence-based databases other than the recognition of the truth that the constituents of herbs, of plants will change from year to year, from field to field, and that is something that needs to be taken into account by the herbalists who use them. It's something that is thought to be balanced for in standardized extracts, although there's some question about how effectively the standardized extracts actually accomplish this. I'm going to type in my, I can't type and talk at the same time. My email address is fbatz@hawaii.edu. It's also at the beginning of the slide set, I believe, and Tracy has it at the college. So again, after today, if you have additional questions that you can't sort out, feel welcome to shoot me an email. I'll do my best to help you out. And that's really the limit of what I've got for you this morning. And are there any last-minute questions?
Great. Well, Forrest, thank you again. It is such a pleasure to have you present for us. This has been wonderful. And for those of you that missed Dr. Batz's webinar I think it was last month, on herb-drug interactions. It was equally remarkable. It was fantastic, and it is on our YouTube channel, as this will be, which is just youtube.com/achstv, and I definitely encourage you to take a look at that. Thanks so much for your time, everyone, and Dr. Batz, we really appreciate you making time to be with us.
Thank you. I appreciate it. I enjoyed it and wish you all the best with using the database and with your studies.
Great. Well, have a great day, everyone. Thank you.
Bye-bye.